You may know Doctors Albritton and Ardovino for making your pretty white teeth shine, and they still do that. But we are going to talk about a new practice here, Alabama Dental Sleep and Wellness, and how this can play into your life in other areas. This is really cool, and you're going to want to know about it. I am joined with the lovely Dr. Ardovino, and we are here at Albritton and Ardovino Dentistry, but we are talking about a new practice that you guys have here. Tell me a little bit about it.
So it is a sleep practice, and we started it because we had a lot of patients in our own office, in our dental practice, who were struggling with CPAP, and they were not wearing them. And we knew as dentists there was something we could do to help them. And so we started Alabama Dental Sleep and Wellness. That's a new practice, and went through all the training. And we make sleep appliances for mild to moderate apnea or patients who can't tolerate CPAP.
Or patients who can't tolerate, or patients maybe like my dad who are just being super stubborn and not wearing the CPAP because they don't like it, right?
Yes, those two. We always encourage CPAP if you can wear it, but we noticed in our own practice there were a lot of patients just not wearing it.
So you went through a training to do this, right? Tell me a little bit about that.
So I went through training at the American Academy of Dental Sleep Medicine. It's a program designed to train dentists so they can properly make these appliances and treat the apnea. Okay,
so let's talk a little bit about these appliances. Is it kind of a one-size-fits-all? Is it very customized? Talk to me about that.
That's a great question. We scan each patient, and each appliance is very custom to the patient, because the way the appliances work, they all work the same. There's different appliances, but they work by moving your lower jaw forward, and that moves the base of the tongue off the airway, which is causing the apnea. Well, everybody's range is different, how far they can go forward. So it's very custom to that patient, and then it's a process once we make the appliance. So we don't just give you the appliance and you're done. We work through it. We can adjust the appliance. We can what we call titrate the appliance until we get to that therapeutic position where the patient's feeling better, and maybe if they're snoring, that's decreased. And then after that, once we get there, then we send the patient home with the device to kind of let us know, are we in the range?
Okay, so we're checking in to see, is this working, right?
Yes. Okay. And then once everything looks good on our end, then we get in touch with the sleep physician, and we like to have a repeat sleep study wearing the appliance. That's done with the sleep physician.
Nice.
Just to make sure everything looks good.
So it's really, you're going through all the steps here, partnering with their sleep physician.
Yes.
It's not just making a mouth guard and then we're sending you off, right?
No, it takes, it can take a few weeks, few months just to get to that position. Everybody's different on how, their jaw and just the movement. So, but yeah, it's a process, and it's also something that, I want to see these patients, twice a year, just to check things. We're monitoring everything.
So if someone's watching this and they're like, gosh, I could really benefit from this, what is the best way to start this process?
Just, you could give our office a call. And we usually, we need to find out if, you've had a sleep study. Do you have a physician? We do not make any appliances without a prescription from a sleep physician. So we have to know what we're treating if you have apnea, and I always get those prescriptions from the physician. So I would say the first step, is call our office, and we can kind of go from there. And if you don't have a physician, we have some we work with that we can refer, to the physician. And then we usually get dental records just to make sure there's enough teeth to support it. Now, these devices are FDA approved to treat mild to moderate apnea. So, and you can also use them on severe patients if they have severe apnea, but that's if they can't tolerate CPAP. So, but yeah, it's a great option. Patients with apnea, you're at an increased risk of high blood pressure, stroke, heart attack. It's a very important to treat it.
Yeah, basically. Absolutely. Okay, so Alabama Dental Sleep and Wellness, now here with Albritton and Ardovino, right?
Yes.
Now Dr. Ardovino, Dr. Albritton also kind of works within this as well. So we'll talk to her, but definitely give them a call if this is something that is speaking to you. Okay, so Dr. Albritton is going to talk to us a little bit about some things that you're using Botox for here in the office, and it kind of coincides with the sleep and wellness as well. But to begin with, if anybody is a Botox lover, you're doing all things Botox here, right?
Yes.
All the facial things that you would think of. Tell us for anybody that's not aware, what do you use Botox for?
Well, first off, we're using it for the things that you expect to use it for. So people think of forehead wrinkles, wrinkles between the frown, the frown lines, the crow's feet, and we do that.
Yeah.
But what I do a lot more of is actually treating patients with TMJ disorders.
Yeah,
so,
and you said that people will come in like just truly desperate. I think if you've ever experienced that pain, that desperation, right?
Yes.
So tell us about how it would work with that and how it would benefit.
Well, we always start with an actual TMJ exam because I need to know if that's the problem.
Okay.
So we want to make sure it's not a tooth issue or something else. And so it's usually quick muscle palpation. We check inside the mouth, make sure that is the issue. And then we'll kind of mark them up and get them cleaned up. And we do a few injection sites. And usually within a few days, they're feeling a lot better.
Wow.
I had a patient this week that I had done it on recently. And she was like, it was so much better after.
Wow.
So it really helps people when they've gotten really in a muscle spasm.
Yeah. And now, what about if you've got a problem like with grinding your teeth at night? Would it help with something like that?
Absolutely. So the neurotoxin like Botox, Dysport, some of the names you've heard before, what it really does is just decreases the muscle's ability to contract.
Right.
So if you're super strong, you've seen those people with those really square jaw lines, these muscles are popping out when they chew gum. That force is going to do damage. So just getting them back to baseline with their muscle strength is very helpful.
Very nice. So it definitely kind of coincides with the Alabama Dental Sleep and Wellness. And but in addition to all of that goodness, you guys just offer good old dental cleanings, all the things, right?
We are general dentists first and foremost. But we both have found things that we're also passionate about branching out of that, and we're just trying to bring that back to our patients.
I think that is so awesome that in this office, you kind of can get a little bit of everything that you need, whether it be a problem that you're having, a sleep problem, which affects so many areas of our life. We just want to look a little bit better, or anything, right? If you can all handle it here, Drs. Albritton and Ardovino, they will handle it for you right here in the Promenade. Couldn't be a better location, but we are really excited for this new practice that you guys are doing, and we wish you all the success.
Thank you so much.
Thank you. Okay, so Alabama Dental Sleep and Wellness, they are here for you, ready to talk to you. Check out the website for more information.